So India is very interesting. India is very interesting because it was one of the few countries that to do a very aggressive lockdown very early. We can talk about the lockdown and the way it was implemented, and there were real problems with migrant workers and a whole set of complex issues, which I'm happy to get into. But the big picture point is, if what I'm arguing, which is that the single biggest differentiator between successful countries and unsuccessful countries is taking the virus seriously, India took the virus seriously. And the lockdowns were clearly effective at maintaining a relatively low level of community spread. That's the good news. The bad news, of course, lockdowns are incredibly expensive, especially for a country like India with large numbers of poor people, a lot of migrant workers, a lot of day laborers. You can't stay locked down. It has pushed millions of people into poverty. And so they needed to open up. But when they did, it became very clear that they had not planned for a long-term pandemic. There really was this magical thinking that somehow the pandemic was just going to be over in a couple of months. Second, they had not built up the testing infrastructure that was necessary, and they had not communicated effectively to the Indian people what a long road ahead there was. And so now the government has really been scrambling, and I would say India is in bad shape, getting worse. So it's true that compared to the United States, India is looking pretty good right now, but it is generating more cases per day now than the US is. And it's still very much in kind of exponential growth. And I expect the number of new cases per day and deaths per day to continue increasing for some time. Last point is that whereas the initial outbreaks were in Chennai and Mumbai and Delhi and parts of Gujarat, the wealthiest, most cosmopolitan, most global cities of India, the largest increases now are happening in Bihar and Uttar Pradesh, which have very, very weak health systems, very little testing capacity, but very large populations. And so I am deeply worried about India, where it is today, and more importantly, where it will be in the weeks and months ahead.